Hi everybody, welcome to Healthline. I am Gregory Zarian. Okay, so it's spring. You're spending more time outside. You are with your friends, you're with your family. As I always invite you to do, hopefully you have gotten off the TV, you have closed your computer, you have put your phone down, and you have actually maybe picked up the phone, called your friend and said, hey, let's go outside, let's go on a hike, let's go running. Maybe mom and dad, you came home from work. I know you're a little bit tired, and because the days are longer, you said, hey guys, let's take the dog and go for a walk as a family. Our mission here at Healthline is to make you and your family the healthiest you can be. And now that the days are longer and the sun is out more, there are no excuses. Together we say, yes, that's what we're going to do. Our conversation today is all about stroke and stroke prevention, stroke awareness, and it's May. It's Stroke Prevention Awareness Month. What do you know about stroke? One statistic that I want to share with you is stroke is the third leading cause of death in the United States. More than 140,000 people die each year from stroke just in this country. So, do you know what a stroke is? And do you know what signs and symptoms are? Joining us from Adventist Health Glendale are neurologists, Dr. Vahe Akopian and Dr. Artin Minaeian. Doctors, welcome.
Thank you.
It's your first time here. Together. Yay! Welcome, and you save lives, and this is one of my favorite topics. Doctors, before we dive into prevention awareness, and we're also going to talk about seizures and epilepsy, give us some of your background, Dr. Akopian.
I got my neurology training done at USC. I actually just graduated a year ago.
Very exciting.
Thank you. And then prior to that was my medical school at St. George's. And then before that, I was at UCLA, so go Bruins.
Or Trojans.
Yeah, I have to pay homage.
You know, he loves both.
Yeah, I do. I actually owe Trojans my medical training too, because that's where I did my neurology training.
Well, congratulations and happy 1 year.
Thank you.
Dr. Minaeian.
Sure. I started with UC Irvine as undergrad, St. George's, same medical school. Did majority of my training in New York, majority of the training in the East Coast, New York Medical College for neurology training. Then I went on to Worcester, Massachusetts for stroke training. And I've been practicing for 3 years in Glendale now.
And so are you new to Glendale then?
Yes, I am.
And you are a team now?
Yes,
we are a team, yes.
Congratulations.
Thank you.
We're already ready to go to our first break. Real quickly, what's the one thing, as we start off, that we need to know about stroke prevention?
That it's in your hands, it's very preventable.
Okay, I love that. Doctor?
You have to know about your risk factors and how to control them before it happens.
Okay, wow, this is going to be good. Okay, so do you know what signs and symptoms of stroke are? Let me ask you this. What does this mean? FAST, the acronym FAST. Get up, take a deep breath in and a deep breath out. Have a glass of water, put down the cigarette, and kind of get rid of that Diet Coke and soda, and get a carrot stick. When we come back, more on stroke and stroke awareness and preparedness. Do not go away. Welcome back to Healthline. I am Gregory Zarian. So how was that glass of water? How was your carrot stick? Did you do some stretching? Did you breathe in? And did you breathe out? And did you know that if you stand for 10 minutes every hour, you lose weight? What? Our conversation is all about stroke prevention, emergency preparedness, what is a seizure, what is an epilepsy. Joining us from Adventist Health Glendale is Dr. Vahe Akopian and Dr. Artin Minaeian. And before we start with the doctors, I want to throw out one more statistic. Each year, approximately 795,000 people suffer from a stroke. About 600,000 of these people are first attacks, and about 185,000 are recurring. Doctors, why is that? Why do strokes reoccur with patients? Dr. Minaeian.
Sure. To begin with, the patients that actually suffer from stroke the first time have had the risk factors. I like to separate the risk factors into reversible forms and irreversible forms. Irreversible being age, genetics, and race, and the reversible ones are usually the ones that we actually try to control. And those patients that have had the stroke usually have the risk factors. Unfortunately, even after the first stroke, 25% of the patients end up having a second stroke, which is recurrence of stroke. And majority of them, unfortunately, are not, the risk factors are not very well controlled. That's why.
But here's the thing. Is it, so we say risk factors, and we'll talk about those in a moment, but is it risk factors because it's hereditary? Or are they risk factors because you'll say, you know what, you've had a stroke, John Smith, because you're obese, and you are pre-diabetic, and all these things happen. You suffer your stroke, and this is what you need to do. You need to drop weight, you need to go get exercise, you need to do all these things. Is this why there's a recurrence? Because patients don't do what they're supposed to do? Dr. Akopian?
Absolutely. I mean, imagine living your life for 50 years one way, and then suddenly someone says, well, you got to change everything. So it's a challenge. I mean, sure, you could change one thing, but in order to fully prevent you from having another stroke, there's like 3 or 4 things in your life that you have to change, right? You have to pick up the exercise. If you're not an exerciser, that's a really hard thing to do. You have to start drinking water. If you don't like what water tastes like, how am I going to convince you at the age of 55 or 65 to start drinking water more often than you used to?
Minimum 10 glasses, 8 to 10 glasses a day minimum.
That is true, yes.
And then what's the third one? You said there's a third one.
I mean, if you're not a medication taker, and I have to tell you you have to start taking a medication, you might think that that alone is enough. But you have to combine that with your lifestyle modification, the exercise, the water, everything.
But
also,
go ahead.
And also going back to you mentioned hereditary. Some of the things are hereditary. They're genetic. Some of them, the genetic forms of stroke are the reason. People can have genetic diseases that can have clotting forms of diseases, and that can predispose them to further or more strokes. And also all the other risk factors that I just mentioned, high blood pressure can be hereditary, diabetes can be hereditary, high cholesterol can be hereditary, obesity can be hereditary. So these are all the reversible risk factors can also be hereditary. So sometimes, despite the fact that we try to treat and prevent further stroke, patients can also, again, have recurrence of stroke.
Which I completely understand, but here's the truth. If you don't change this, you're going to die. You know, we talk all the time about smoking here. Mm-hmm. If you don't quit smoking, there's a possibility you're going to die. If you are obese and you don't lose this weight, you're slowly killing yourself. You are going to die. Is that not enough to say to a patient or someone after 50 years that's going to do something different? Doctor?
That is true. I mean, we try to word it differently in front of the patient, but at the end of the day, I mean, we all use the term dying. Unfortunately,
you could say pass away. You're not going to be here long. Bottom line is, you're either here or you're not. And you know, other than hereditary maladies, we are in control of what we do. You know, I smoked for 20 years. I stopped. It wasn't easy. I stopped. You know, I was 30 pounds heavier. I wasn't eating as healthy as I could. I made different choices, and it wasn't just I woke up and I was a non-smoker and I was 30 pounds lighter. I actually had to make lifestyle choices because both of my parents have died from cancer.
True.
So it's about making choices.
Exactly. And to add to that, younger patients, which we try to categorize them as younger than 65 years old, tend to be more careful, just like you said, you quit, tend to be more careful after their first stroke. Is when
I love that. Yeah. So they get scared.
For some reason, as Dr. Akopian just mentioned, when you get older, it becomes way more difficult to actually quit a habit that you've had for 50 years.
And because we're set in our ways. Signs and symptoms of stroke, Dr. Akopian. What is this? First of all, what is a stroke?
So my idea of what a stroke is it's when a part of your brain stops working. So I think of it as a decrease in activity.
Okay.
Very specifically, if you want to be physiologic about it,
Please.
Sorry for the fancy word, it's when the blood supply to a portion of your brain is cut off, and that portion of the brain stops getting oxygen and dies. So it's permanent damage to a part of your brain.
And there's two types. Well, I always say that when you suffer from a stroke and then you have to rehabilitate, it's kind of like you were driving down a street and there's a street closure. And to get your functions back, you have to go down a different street to come back. Before we already go off into our second break, tell me the two types of strokes, doctor.
Sure. I like to categorize them. We call them ischemic, which means clotting. And the other end of the spectrum is hemorrhagic strokes, which is bleeding types of stroke. Ischemic or clotting types of stroke, the clot can come from the heart, can come from the aorta, can come from the carotid arteries, and sometimes even from the legs if you have immobility. And the clot can travel to the brain and clog up the artery, and the tissue behind that clot will not receive blood, and you will have the ischemic type of stroke. The other type is hemorrhagic, which is rupture of an artery.
Which is more fatal.
It's more fatal. The fatality and prognosis are actually worse.
Thank you. More with Dr. Akopian and Dr. Minaeian when we come back. Don't go away. Welcome back to Healthline. I am Gregory Zarian. Adventist Health Glendale is the first medical center in all of California to receive Comprehensive Stroke Center accreditation from DNV. By earning this accreditation, Adventist Health Glendale has shown that it exceeds patient safety standards set by Medicare and Medicaid. Yay, Glendale. Adventist. Joining us from Adventist Health Glendale is Dr. Vahe Akopian and Dr. Artin, Minaeian neurologists. Our conversation is all about stroke awareness, stroke preparedness. We talked, doctors, a little bit about the two types, ischemic and hemorrhagic. What are the signs and symptoms?
So the usual signs and symptoms are going to be weakness or a lack of ability to move on one side of the body. That's the most common way to think about it. Usually people will have weakness in just the left arm or just the right leg. You might have sudden onset numbness in just one part of the body.
But could it be opposite arm and leg as well? It doesn't matter, does it?
It doesn't matter, yeah. It might, usually it's just going to be the one side. You're not
Okay.
going to get both sides at the same time. That's the most common way. But you can sometimes have it on both sides. And the key here is it's most often painless. And then another symptom that people commonly can have is inability to talk or to understand speech.
Which breaks it down to what we were saying earlier. But real quickly, just so I can be clear though, when you say symptoms on the left side or the right side, is it all the way down one side, or is it from the torso up, from the leg down, or?
Depending on the location in the brain, because the fibers are always coming together in different ways.
Okay.
If it hits the right bundle of fibers, it could affect the face, the arm, and the leg all at the same time. Or if it hits another bundle of fibers, it might only affect the left face and the left arm.
Okay.
Or it might only affect the left leg. So you might get pick and choose, and it's hard for us to say ahead of time which one it's going to be.
Okay, and Dr. Minaeian, we were talking before we started filming, and I actually asked the audience if they knew what the acronym FAST was.
Sure.
And spending a little more time with what Dr. Akopian was saying is FAST is the acronym for
recognition of stroke.
Signs and symptoms.
Signs and symptoms, yes. And now they've added the BFAST, B-E space F-A-S-T. Those are mnemonics to help the general community to be able to recognize signs and symptoms of stroke. And you've probably seen the posters in the hospitals and even in the community centers. It stands for B, stands for balance. So patients can have gait issues and they can sway to one side or the other with balance. And then E stands for eyes with large ischemic strokes or even hemorrhagic strokes. You can have your eyes deviated to one side or the other. That's a sign of a large vessel occlusion. So eyes can be deviated to one side or the other. And then F is for face, facial asymmetry. So with strokes, you can have your facial drooping. Arm, you can ask the stroke patient to hold up their arms in front of them. Sometimes you can ask them to close their eyes. You will see sometimes you see drifting, what we call, or even sometimes paralysis.
So do you recommend to do the arms at the same time or one at a time?
Together, so you can compare.
Okay.
It's much.
And you want them to be together, so if one is drooping a little bit more, you have to pay more attention
exactly.
to that. Okay.
And then S is for speech. You can have slurring of speech, or you can have difficulty producing speech, or even understanding speech. So those are the types of. And then time is actually what everyone concentrates on, especially in the month of May. Time is.
Time loss is brain loss.
Time loss is brain loss, exactly. I mean, once you see the symptoms, you have to pick up the phone call and call 911. And the patient has to be in an accredited center for better treatment.
Like Adventist Health Glendale, because a lot of people, most people need to know where their accredited stroke center is.
That's right.
Here locally, it's Glendale. Exactly. And not to discredit any other hospital, But if you go to another hospital, time loss is brain loss. You're losing time.
That's right.
So, doctor, just say somebody suffers from a stroke. From their house to the hospital, what is the perfect amount of time or the best amount of time do you get from onset symptoms to being treated?
As fast as possible. I mean, there's some criteria for 3 hours, there's some criteria for 4.5 hours. Sometimes, depending on the kind of stroke, there are things we could do with 12 hours, but all that matters is you do it as fast as possible. If you wait an extra 45 minutes, that might be something permanently damaging to your brain. And one thing I actually really want to stress is a lot of people think that, oh, if I call 911, it's going to take them a long time to get here, it's just faster for me to drive myself. And the fallacy there is you have to wait in the emergency room, someone has to look at you, someone has to decide what's happening before you get seen. If you call 911, they're going to call ahead of time to the emergency room, tell them what's coming, and that's going to open so many doors and you get in faster. So if there's a stroke, call 911, it's much, much faster than thinking you can do it yourself.
Thank you. One thing that's important too, and I say this again, is in your wallet, ladies, in your purse, give your husband, wife, friend, family, child the medication you're taking. Because if somebody's suffering from a stroke, there could be competing medicines and also your health history. Just because the more information you have, the better you can treat me. Doctor?
No, that's actually a very good suggestion. I've done it for my parents, and I suggest it to other. Sometimes as doctors, we don't have enough information when the patient gets to the hospital or to the office, and it's very important to have the medication. Is because we can backtrack kind of with the medication. We can know what type of medical issues you have, and it's always important when you come in with a stroke. We want to make sure you're not on a blood thinner. If you're on a blood thinner and we give you more blood thinners, we can cause damage, more damage. So it's always a good idea to have your medication list on you and the medical problems that you have.
Thank you, doctor. More on stroke prevention and awareness when we come back. Don't go away. Welcome back to Healthline. I'm Gregory Zarian, and it's May, and it's Stroke Prevention Awareness Month. Purple, lavender, is the color for the conversation of all you need to know about stroke. So get your purple on in May this month and have a conversation with your friends and your family. The more information you know, the bigger gift you're going to give to your world. Joining us from Adventist Health Glendale are neurologist superstars, Dr. Akopian and Dr. Minaeian. Okay, so Dr. Minaeian, somebody is brought into Adventist Health Glendale, Certified Stroke Center. They're there, they are suffering from an ischemic stroke. Clot busting procedure, TPA. What is that and what happens from there?
Sure, TPA is one of the strongest blood thinners that we have in the hospital setting. It's only given in a hospital setting. It's most of the time given down in the emergency department. It's given through intravenously. It runs over an hour. And the idea is for that medication to circulate in your body and pretty much dissolve any clots that are clogging up any arteries. That medication has to be given for ischemic stroke patient, has to be given within 3 hours, and certain types of patient up to 4.5 hours time. It is now the standard of care, and before that is given, every type of bleeding disorder or any active bleeding anywhere in the body has to be kind of ruled out, most importantly in the brain, before you give that medication.
And depending on how much time has occurred from onset of stroke to TPA, that's how quickly they will heal. And it's basically rehabilitating in their brain their quality of life and their functions and all of that.
True. The sooner you give the medication, the quicker you open up the artery, the quicker the tissue behind the artery gets, behind the clot gets the nutrition and the oxygen, and the better the recovery has always been when the TPA has always been given sooner. Sooner the better.
Thank you. So then when we first started, Dr. Akopian, I mentioned epilepsy, I mentioned seizures. Are these all the same? Are they the same signs and symptoms?
No, it's very different, in fact. I have patients who come into my office and we have a conversation and she says, oh yeah, I had 3 seizures back, 10 years ago or 5 years ago, and we talk about seizures for a long time, and then I find out that in fact she had a stroke, and it wasn't a seizure at all. So I want to spend a minute explaining
Please.
the difference, and I feel like it's important to understand a seizure, or a stroke, since we've been talking about it so much, is a lack of brain activity because a part of the brain dies. But in a seizure, what happens is the electrical activity in the brain actually increases.
Okay.
And it's abnormal electrical firing in a part of the brain. And that seizure has to start somewhere in the brain. And so depending on where it starts, that might be the first symptom somebody feels. So if it starts in the part of the brain that controls the right arm, somebody might start shaking in their right arm and having some kind of shaking activity that they can't control. And then it may suddenly spread to the whole body, and that's where you see seizures like they show in the
Full
movies.
bodies, sure.
Yeah, where people are on the floor, they're shaking, and they're maybe frothing at the mouth. All the movie stuff that you see, right? But in order to spread to the whole brain, it's got to start in one part of the brain and get there.
Is that the same as an epileptic?
That's right.
Oh,
so
an seizure.
if someone has seizures repeatedly, we call that condition epilepsy.
Okay. Is that hereditary as well?
It can be.
Mm-hmm.
And so how does that happen?
That may be a problem with the neurochemicals in the brain. That might be a problem with the channels or the receptors in the brain. It might be a problem because a specific part of the brain grew in the wrong way.
Okay.
Some kind of fibrotic tissue, or maybe they actually had a stroke in the past, and now a part of the brain doesn't work the right way and it fires abnormal electricity.
So then are you born with the possibility of epileptic seizures? As per with stroke, you can also bring in, you're more in control of having a stroke than having an epileptic experience, true?
Sure.
Do you understand the question?
Yeah, I mean, you can be born to have structural damage, as Dr. Akopian mentioned, in your brain.
Okay.
And that can just predispose you to having seizures down the line, or even at birth. You can have seizures. Just same way you can have hereditary conditions that can make you have strokes at an early age, even in the fetus.
Yeah, we've talked about that before on the show. That a mother, his name was Gavin, and he's a superstar at Venice Health Glendale. Big survivor, stroke in vitro with his mom.
Oh,
Wow, yeah, that's
No, in vitro. Is that right? Did I say that
in
right?
utero.
In utero, sorry.
Oh, yeah.
I'm just the host. Within this conversation, what do you want us to know about prevention? Prevention, let me say, in regards to seizures. Can we prevent seizures, and what can we do?
One thing I want people to understand as far as seizures go is a seizure doesn't cause brain damage the way that a stroke does. So a single seizure doesn't cause brain damage, but the ultimate way to prevent them is through medication. Unfortunately, exercise, lifestyle modification, while that's good for your general health, doesn't necessarily stop seizures from happening. So we have lots of medications out there. There's maybe 20 available right now on the market. And if I were to just give data, every time someone tries a medication, there's a 2/3 chance of it working.
Okay.
So the first time you try a medicine, there's a 2/3 chance. The second time you try a different medicine, there's another 2/3 chance. Ultimately, about 80% of people right now are completely controlled on medication.
That's fantastic.
Yeah.
Doctor, in regards to stroke.
Sure. As Dr. Akopian mentioned, lifestyle modifications include diet and exercise. With dieting, that's a general consensus that you have to keep your calories within 2,000 calories per day. Imagine having 3 meals and 2 snacks. Each one of them cannot be more than 600-700 calories ideally. With exercise, at least moderate exercise is recommended. That's about 150 minutes
a week, minimum.
Minimum per week, yeah. Or 75 minutes of rigorous exercise is the recommendation. If you're a smoker, you have to quit smoking. That's the only solution. It's not easy, but doable. And you have to know your numbers. You have to know your blood pressure. You have to know your cholesterol levels, and your diabetes. Get it under control. And there's always doctors around. You always have to be in contact with your doctor to have all these risk factors under control.
Final quick thought in regards to May being Stroke Prevention Awareness Month.
Prevention. It's prevention. I tell people 3 things. Drink 8 glasses of water a day. Have at least 4 servings of fruits and vegetables per day, fresh fruits and vegetables. and exercise 150 minutes a week.
Love that. Same thing for you, doctor?
Yes, and the Mediterranean diet, obviously the
Oh,
fruits
yeah,
and
that's a good one.
vegetables, cut down on saturated fat and trans fat, and protein also.
And we're Mediterranean. Look how good we look. Doctors, thank you so much.
Thank you for having
Thank
us.
you for having us.
Okay, so get your purple on. Have a conversation. You are in control of your body and your health. Ask your parents about your family history. Pay attention. Write down the medication you're taking. And know where your accredited certified stroke center is. Adventist Glendale, certified, credited, and award-winning. Remember, the most important conversation you're going to have is about you and your health. And also, why not have it with us? Join us on social media at YouTube at AHGL Healthline, and follow us on Facebook at AH Glendale, Twitter at AH Glendale, and LinkedIn Adventist Health. And you can always find me at Gregory Zarian. Have a great conversation. Have a great day. And once again, get your purple on. We'll see you next time.